Thank you and good afternoon to everyone. I'm very hopeful that everyone watching today and everyone throughout Mississippi had a safe and restful Labor Day weekend. I'm incredibly grateful to everyone for their hard work, which has put us where we are today. Mississippi has truly turned a corner, and it is because of you. It is because you have bought into your desire to help yourself and help your friends and help your neighbors. But we also know that with this virus, we cannot let our guard down. Things can change very, very quickly. We do, however, need to take a moment and appreciate the commitment and ability of the people of this state to look after one another. Thank you. From the bottom of my heart, thank you for allowing us to push the numbers down. But every single day we have to make a new decision. Are we willing to continue that commitment to continue to drive these numbers down? Today, we of course have Dr. Dobbs with us, and we're glad that he's here, and Director Michelle will speak later as well. But I wanted to begin by bringing our Commissioner of Public Safety, Commissioner Tindall, to join us. You'll remember that our reopening plans for driver's license bureaus have been in effect now for several weeks. When we announced our plans that this part of state government has been totally broken for a long time. It just didn't work right for the people of our state. It was frustrating, it was confusing, and it was slow. And that was before COVID-19 hit. And when COVID-19 hit, and we had to shut them down to protect not only our state employees, but also protect our fellow Mississippians, things got worse. And they got worse because those bureaus were closed. When I was running for office in 2019, I acknowledged that the next governor would have to come in and fix it. When I talked to Commissioner Tindall and asked him to take on the reins, I asked him to do everything in his power to quickly get it fixed. And I'm happy to tell you today that while we still have a ways to go, we are making real progress. I understand that in the month of June, we did over 90,768 issues. In July, it was 96,583. In August, it was over 80,000, 267,000 in the month of June, July, and August. That's a 77% increase in the number of customers served from 1 year prior. That is a testament to Commissioner Tindall's leadership and to the brave men and women that work at the Department of Public Safety, and I commend them. But we also know we got to continue to get better. And today we're announcing more efforts to change and improve. These efforts will help Mississippians skip the line and get in and out more quickly. That obviously helps with COVID-19 safety. It's also just better. It treats with respect for your time and the wise use of your tax dollars. And so with that, I'm going to turn it over to Commissioner Tindall and let him tell you about our new initiative to skip the line. Commissioner.
Thank you, Governor. We at the Department of Public Safety and the Driver Services Bureau are excited to announce our campaign. The first is a major announcement. It's the online appointment system. And starting September 14th, which is next Monday, customers and citizens of the state of Mississippi will be able to go online to the DPS website and make an appointment to have their driver's license exam, firearm permit, other things scheduled in order to come in for a specified appointment time. Again, for the first 2 weeks, it's going to be at Troop K, which is on the Gulf Coast, and Troop C, which is the Jackson metro area. We're going to run that program for 2.5 weeks, and then starting on October 1st, we will go statewide with the program, and that'll be at all permanent driver's license stations. We've also implemented in Troop K and Troop C the Skip the Line cam, so that customers, before they're arriving at the driver's license bureau stations, will be able to go onto the website, DPS, and view the line. If there is a line, they might want to come at another time. But it's the Skip the Line cam, and right now it's available at Troop K and Troop C. And again, by October 1st, we will have that going statewide. In addition, we're doing the online and mail-in firearm permit renewals. No longer will you have to go to a driver's license station or a troop station to get your firearm permit renewed. It will be mail-in only. You will not have to submit fingerprints because, as everyone knows that does a firearm permit, you do your fingerprints the first time. And so we've done away with the need to have to do your fingerprints for your subsequent renewals. Firearm permit renewals will be mail-in only. And in addition, and finally, starting on October 1st, we will do away with the alphabet system that we did as a temporary solution to reopening after the close down due to COVID. And so we will no longer be utilizing the alphabet last names, certain days of the week, starting October 1st. In addition, we will also be doing issuance of firearm permits at all troop stations across the state. And so you'll be able to come in and get a new firearm permit any day of the week. You can schedule an appointment or try to do a walk-in, and we'll be able to do that every day of the week. And the change there is a result of training our driver's license service examiners to be able to do the fingerprints on new ones instead of having to utilize an MBI officer to do the fingerprints. So that will begin on October 1st. And that is our Skip the Line campaign. We're looking forward to some other announcements coming in the future, some utilizing technology again to improve our customers' access to driver's license services. I'd like to commend the staff and those that work at driver's license services, particularly Colonel Brown and the job that he's done in helping implement these, as well as Deputy Commissioner Davis and the effort that they've put forth in coming up with these really good and innovative ways of improving what we do at driver's license services.
Thank you, Commissioner Tindall. I appreciate you and your entire team for stepping up. We believe that it is our job as public servants to serve the public, and certainly these are initiatives that are going to help us do exactly that. One of the things that I learned in talking to Sean over the last several months is in many of these facilities, if you go at 8 a.m., there's a 4-hour wait. If you go at 3 p.m., you can walk right up and get things done. And so that's where the idea of putting the camera out so that you can actually look and see kind of what the line looks like. Obviously, we're also trying to protect against COVID right now, but long term, that's also going to give people the opportunity to be flexible. It also the statewide appointment process gives everyone the opportunity that a lot of these folks, a lot of our fellow Mississippians are working, and if you have an appointment, gives you the opportunity to set that appointment and not have to come and just wait and wait and wait. And so I'm just extremely pleased with the progress that Commissioner Tindall has made, and there will be issues and there will be growing pains over the next 2 to 3 to 4 weeks as we deal with these things, but certainly I believe that this is a major step forward after the 267,000 people that we've served over the last 3 months. And so, again, congratulations, Commissioner Tindall, and the Commissioner will be available for questions in a little while. At this time, I'm going to turn it over to Dr. Dobbs, coming out of Labor Day weekend. It seems like Memorial Day to some of us, but coming out of the Labor Day weekend, we certainly continue to see positive developments in terms of numbers, but we won't, of course, see what happened over Labor Day weekend for the next week to 10 days. So with that, I'm going to turn it over to Dr. Dobbs.
Thank you very much, Governor. So today we're reporting 249 new cases and very happy to report no new deaths. However, we suspect that some of that's just a manifestation of Labor Day holiday, but still love to have 0 deaths. I know we'll have additional ones tomorrow, including someone under 20 who died over the past couple of weeks. So we'll be reporting that out tomorrow. If we look at our total number of cases thus far, 87,379 with 2,585 deaths, we know that this is likely an underestimate or undercounting of the total number of deaths because we know our excess mortality this year compared to previously is around 3,300 people. So that's something you'll be seeing more and more information out. We've been looking closely at our vital statistics data, so there will be more information published on our website about excess mortality in Mississippi during the COVID era. If we look at what's going on in counties, we're happy to see that the majority of counties have shrinking case burdens. When we look at the most recent 2-week data with the 7-day lag, we saw that 62 counties were shrinking in the number of cases that they were having. 20 had increased, but we did see some specific outliers, especially Lafayette County and Oktibbeha County. They have the distinction of being counties where we have major universities. We didn't see the same sort of increase in Forest County, thankfully, or other counties, but Lafayette had an increase of 244 cases over a 2-week period compared to the previous, and Oktibbeha 141. Certainly want to watch that closely. We'll continue to work closely with those leaders and those schools to make sure we try to fight coronavirus outbreak in the college setting. We want to make sure we keep our guard up because we know if we let our guard down, we can have massive rebounds. I would encourage everyone to look at what happened in Spain and Israel, who thought they had it licked, and now their case rates are higher per capita than the United States. So please, just be very careful. We have made some phenomenal gains. We want to maintain that, so make sure we keep our masks on, separated from other people, and small groups as much as possible, and then do as much as we can outdoors. A couple of other interesting things today. We are announcing that we are going to go to community testing with more availability every county, every week, and that will be for anyone who has any symptoms of COVID, is concerned they might have been exposed, and of course K-12 teachers, staff, and administrators. So that's something that's on our website, and you can go to covidschedule.umc.edu to schedule an appointment in any county, and we'll be there at least once a week starting this week, so please check that out. And the other thing I just want to mention is we are very concerned about nursing home folks, not only for their safety, and we're working hard for that, but also visitation. We have found a mechanism to make outdoor visitation more and more available. So if you do have a loved one who is in long-term care setting, please call the center and see if you can visit outdoors, even if they've had a recent outbreak, because there are mechanisms to get to spend time with your loved ones, although there will be some obvious space and restrictions to make sure there's no risk of transmission. And Governor, that's a lot. That's all I have. Thanks, sir.
Thank you, Dr. Dobbs. Appreciate you and your team as always. We'll turn it over to Director Michelle, who hopefully is not going to announce that we have a hurricane in the Gulf, right?
No, sir, I am not. Thank you, Governor. Good afternoon, everyone. Real quick tropical update, just to give you an update on tropical storms Paulette and Renee. If you've been tracking the weather out there, you know that we do have these two storms out in the Atlantic. Current modeling, consistent modeling is showing that these storms will make a turn out into the North Atlantic. They do not currently appear to be a threat to the U.S., to the United States. We are looking at a system that is off the East Coast. It will not be a threat to Mississippi, but it could pose a threat to the Carolinas. Watching that one for development and to see what the second, third order effects from that might be to us, but we don't anticipate any. And then finally, we are watching a system, another one, coming off the coast of Africa that has a 70% chance of development. It's always a concern this time of year, those storms coming off of there, as to where they may end up in the Caribbean basin. So we'll keep our eyes on that at this time. Quick update on the COVID relief program. To date, we have approved 105 applications for counties and municipalities for this program. Of those 105, MEMA has approved 9 projects, a total of $2.8 million. One thing I want to point out with that, the disparity in those numbers, the 105, those are applications, means that counties and municipalities have applied for and have gained authorization to be eligible for the program. What is important to note is we only have got 9 approved projects. We have some more projects in the queue, but not nearly as many as we would like to see at this point. $2.8 million, we've got a long way to go. So I encourage counties and municipalities to not only get your applications in, but you must get your work your projects in so that we can get those, approve those, and get those out to you. And a reminder to everyone that this is a reimbursement program. It is not a grant program. In order for you to receive these monies, you must submit application for reimbursement for monies that you spent that are COVID-related. MEMA is in the process of launching a virtual tour this week with all of the students and teachers that we've got that are having to school at home or online. This just gives another opportunity for students to provide a virtual tour of MEMA. It's very professional, very proud of that opportunity, and it will be available in the coming weeks to be able to do that. Reminder that September is National Preparedness Month, reminding everyone that not only for hurricane season, but you should also always have a disaster kit and have a plan for any type of weather that may come about. And then finally, a reminder that the 2020 census deadline is September the 30th, so please take part in that, for that does have effects on our disaster declarations based on population. Governor, that's a quick update. That's all I have today, sir.
Thank you, Director Michelle, and again, I thank everyone for being here today, and we'll open the floor to questions. Yes, sir.
Thank you, Governor. I'd like to start with something in the city of Jackson that happened last night. Not sure if you saw, but there was a massive party off of Dixon Road, mainly tied into the Jackson State community. Hundreds of college students coming out. I'd like to just ask, and Dr. Dobbs, you could add to us, it'd be great. I mean, what do you just make of that, and what do you say to those kids who aren't taking it seriously? Do you fear that it's going to send us in the wrong direction with massive block parties unfolding?
Well, let me first say this is the first I've heard of it. I evidently didn't get my invitation to the party. I would not have gone had I gotten my invitation. But let me just say that that obviously it is those type of events, as at least the way in which you described it, that could become super spread. If you have a couple hundred of people at a party, whether it's in Jackson, Oxford, or Starkville, or Hattiesburg, or Cleveland, or any of our other college towns, then it certainly runs the risk of becoming a super spreader event, and that's certainly concerns me. And again, I don't know anything about the specifics. This is the first I'd heard of it, but we are strongly encouraging Mississippians to continue to pay attention, to not allow the gains that we've made, really, quite frankly, over the last 8 weeks. I mean, we have seen, I look at these numbers every single day, first thing, or even some days now we're back to a number that is small enough where we're actually getting at least preliminary data late at night. And so we've got to continue to remain very, very focused on slowing the spread and reducing the spread of this virus. Think about where we are today. Think about the fact that we're, for most kids, in week 5 or week 6, or some even up in Alcorn County, week 7 of kids being in the classroom. We've actually had our college campuses open now for 2 or 3 or 4 weeks in some instances. And while we've certainly had some transmission, overall transmission has been declining. We want that to continue. We want our kids to stay in school. We've had our first college football game at the University of Southern Mississippi on Thursday. We have other college football games coming up late this month. We have had high school sporting events occur, and we've had to adjust the way in which we do it. We've had to reduce and limit the crowd size. It has not been perfect, but it's been a lot better than over half the states that have had none of those things happen. And so what I would say to all Mississippians is the reason that the numbers are coming down is not anything that I have done or that we have done. It is because the people of Mississippi have bought into doing what's right and taking that extra step of wearing a mask, of staying socially distanced, of adhering to the rules. And for every instance where individuals choose to make poor decisions that lead to more spread, the more difficult it makes life for everyone else.
Dr. Dobbs, what are the health risks, even if you are outdoors, but hundreds of people are around you shoulder to shoulder? Did you hear about this party?
I didn't. I've heard other things too. It really makes me angry. How selfish it is. Right now, we're just making progress, and we're trying to let nursing home folks get visited. We have people who are dying. Schools want to stay in session. Colleges want to stay open. And just to have such little patience and to have such little restraint that you can't do. I mean, if someone's having a party, don't go. And if you're putting up a party, know that you're breaking the law. We spoke with President Hudson, I think it was last week, and then the other college presidents at several places, and they're committed that if people go to parties or host parties, it is a violation of the honor code of the university, and there will be repercussions. So I hope it doesn't come to really undermine us in our long-term progress, but I'm disappointed. I am disappointed.
Just to follow up on the block party, what more can be done at the local level? In the case of this party on Dixon Road last night, what more can be done to stop these large social gatherings?
Well, clearly, if it occurs wherein someone can see it, I mean, clearly local law enforcement has the ability to enforce the limitations on crowd sizes, and certainly in a situation such as this, as it has been described to me, that's something that we need buy-in from local law enforcement to do that. I don't want to solely focus on that particular one event, because what I will tell you is over the last couple of months, the vast majority of Mississippians have really made sacrifices and have made a real difference in our efforts to slow things down. And so, again, I'm not familiar with the specifics of this event, but as Dr. Dobbs just said, don't throw big parties. And if there is a big party that you hear about, don't go, because we want to reduce the crowd sizes so that we can ensure that we can maintain social distancing. It is important that we wear a mask. Clearly, outdoor events are better than indoor events, but at this point, we still have a executive order which limits crowd sizes outdoors for social gatherings to 20 people or fewer, and we've got to continue to work with local law enforcement and others to try to enforce it to the extent possible.
A question for Dr. Dobbs about the community testing in every county every week. Could you give some extra details about that? Is it similar to what UMC has been doing in partnership with y'all, or is it just like community health centers?
No, it's going to be at every county health department. We will have a drive-through clinic every week, and you can go online. We have several partners. Certainly very thankful for our National Guard partners who are doing the bulk of the manpower work. The health department personnel, and then UMC is helping us with scheduling, testing, and reporting. So it's a fantastic partnership, similar to the one we do on the West Street Old Farmers Market, and we're going to have that available in every county and every county health department drive-through. But still, community health centers have been fantastic, and as have local docs. So still go see them. But as an option, we want to make sure that people have access to testing right now with the lowest possible barrier.
I'll just add that we made the decision to increase our commitment from the Mississippi National Guard. We're adding personnel. We cannot thank those men and women in uniform enough. They have been exceptionally helpful since the beginning of this crisis. In many instances, doing things that they're just not normally doing. Obviously, President Trump has been exceptionally helpful with Title 32 funding. Certainly, what we're trying to do is, if you are a teacher, particularly if you're a teacher and you're in the classroom and you either have symptoms or you're just very concerned being in the classroom, go get tested. You're going to have an opportunity within your own county at least one time every single week to get tested, and we encourage people to get tested. If you think you may have COVID, go get tested. If you're concerned about COVID, go get tested. We strongly encourage it, and because of our commitment by Dr. Dobbs and his team and our National Guard partners, our emergency management professionals, we are certainly giving people that option.
Thank you, Governor. This is for Dr. Dobbs. I know I've heard both of you talk about this over the course of these briefings, that we let our guard down in late May, early June, and we saw what happened. Looking at the data, do you see any parallels with what we saw in May? Because there were some encouraging trends at that time, that may have contributed to that. And even if there's not a pattern in the data, a pattern in our own practices as playing a role in this too, as we get into this period.
Most indicators look pretty favorable right now, but we do have some sort of areas of concern. Certainly, we're seeing spikes in cases in some counties, especially around colleges. The schools, the K-12, have by and large performed better than anticipated, but I think that speaks to their commitment. The colleges and universities have fantastic commitment to prevention on their campuses, but it's those after-hour social events that are just our Achilles heel. So it's a different sort of vulnerability, I think, than we saw before. I'm hoping that people are taking it more seriously. When I was out and about this weekend, it didn't seem quite as rambunctious as Memorial Day or 4th of July, so I was encouraged by that. But we do have some weak spots, and we'll have to watch them closely.
That different sort of vulnerability, just maybe.
Well, college-age kids, that's the big one. And what we worry about is going to be getting sick, taking it back home, basically reseeding the community. And, with kids being asymptomatic or younger folks having milder symptoms, they can spread it and not know it. And so you take a young person who feels pretty well, who's contagious, out and about, enjoying life. It can be a real challenge and also a danger to the gains that we've made. So just really encourage all of us to be diligent and just follow those simple rules: masks, 6 feet, and in small groups, and we'll be all right.
We now find ourselves in a position in which approximately just shy of 25% of all cases in Mississippi are in that 18 to 29-year-old age group. We know that there is when you talk about vulnerabilities, that is an area that is, by the way, not unique to us. You look at what happened on the campus of the University of Alabama, for instance. Tuscaloosa is not that far from the Mississippi-Alabama state line. We have a lot of Mississippians over there, but there is no doubt that they have seen significant transmission on their campus. And I commend our university leaders for their plans. They're working diligently. They've really done well, and we're proud of them. Same can be said at our K through 12 schools, but we've got a lot of work left to do, and so we just. The reality is the trends are incredibly favorable for us, and they have been for almost 7 weeks now. But things can change very, very quickly with this virus, and so we do not want Mississippians to let their guard down because, again, I firmly believe that what Mississippians are doing right now, 90% of Mississippians are able to do about 90% of what they want to do. And that beats the heck out of where we found ourselves in March and April when there were massive shutdowns, particularly in other parts of the country, but massive shutdowns of small businesses, of the economy, of other things. What we're saying now is if we can just simply have people wear a mask, stay socially distanced, and avoid large gatherings of large numbers of people, particularly indoors, then we can keep these numbers down, hopefully. Yes, sir.
Thank you. This is a question for you, sir. I'd like to go back to the Skip the Line program, if I may. So you said this is first starting in Troop K and Troop C. When can we see it in the other troop areas? And can you just elaborate a little bit more about what this means if you need to renew a driver's license or renew a firearm license again?
Sure. Starting September 14th, in Troop K and Troop C, you'll be able to use the online reservation system. You'll be able to go to the DPS website and schedule an appointment to come in and get your service at a specific time so you know when to show up. That will go statewide on October 1st. The reason being that we want to give ourselves a couple of weeks to work out any kinks that we might have on a much smaller scale versus going statewide right off the bat. And for those getting firearm permits, particularly new ones, they will be able to schedule an appointment as well to come in and have their firearm permit done. And it will be every day of the week. As it stands now, it's only been on Wednesdays that you could get firearm permits. But going forward, Monday, Tuesday, Wednesday, Thursday, Friday, people will be able to come in and get their firearm permits, and they'll be able to schedule an appointment to do that. Firearm permit renewals, again, that will be mail-in only. and you won't have to go and get fingerprints again. You'll be able to mail in your application along with a check for your renewal fee, and we will mail you back your firearm permit.
Where's this website link, by the way?
It's if you go to www.dps.gov, you'll be able to find a link to it if you go to the Driver Services Bureau.
Right.
Try the next one.
Hi there.
Hi, Nick.
I have two questions for Dr. Dobbs. So we'll have a quick follow-up after this. Based on last week's school reporting, there seems to be a couple hundred schools which are still not reporting new cases and quarantines. When can we expect full data, and are any districts refusing to cooperate with MSDH?
We have not had any that have refused. We're still collecting the data today for this week. You know, with Monday being a holiday, we gave them till Tuesday. We wanted them to get a break too, to turn in all their data. So we should have additional information today, and we haven't had any refusals. You know, we still have some folks that are virtual, and those are not necessarily reporting. But we should have an update on that number hopefully later today or by tomorrow. Any other question, I think, Nick? Or you're still muted?
Hi, yes, thank you. So with our increasing understanding of the aerosol transmission of COVID-19, is MSDH planning to issue any additional guidelines on ventilation or social distancing in closed spaces?
No, I think some of the rules that we have sort of baked in are really, especially the mask situation, account for that possibility. You know, the data looks like it's kind of like it's a little bit of both, right? It's mostly droplet and occasionally aerosol, and part of my feeling about it is, quite honestly, is I think that the masks are really good about converting super spreaders who are aerosol based into non-super spreaders, and that's where you get a lot of the gains. I think if we can just do the things we have right now, especially if we're going to get together and, you know, if you're going to eat outdoors and that sort of thing, that's my preference. I think that will account for some of the potential risks from aerosol transmission.
Thank you.
Thank you, Nick.
You keep going.
Okay, hey, thank you, Governor, from WLOX. And I've got a question for Governor Reeves and for Dr. Dobbs. First of all, for Governor Reeves, you talked quite a bit about large gatherings here in the news conference today. We have possibly the largest gathering in the state coming up on the coast in about a month from now. Cruising the coast, they are planning to go forward. Any recommendations you have for that event to go on safely? And for Dr. Dobbs, we have learned that a teacher in Jackson County has passed away from COVID complications. Do you have any data, or are you tracking in any way teachers who may have died or
in weeks and months? Certainly in the coming days and weeks, we've got executive orders in place, and as long as those events can continue to adhere to the guidelines of ensuring that you wear a mask when in public. As the current EOs are up on Monday, and so we'll have announcements later this week as to our decisions as to extending those or not, to adding to or decreasing any guidelines that are in place. But if the event can go forward and social distancing can be ensured, and individuals can wear a mask, and those large group gatherings are not of a size that is larger than what is allowed for, then we think certainly the measures that we currently have in place are helping us reduce the numbers, and we hope that continues to be the case.
Yeah, and in regard to the the death of the teacher in Jackson County, such a tragedy. I wouldn't think that we're going to report any deaths, by occupation as a measure not to identify any individual. So wouldn't anticipate we'd do that would be included in the total number of deaths, but really just a potent reminder of that this can be a horrible disease. It's almost like the reverse lottery. I mean, just because most people don't die doesn't mean that some people aren't, and it's not going to be someone you love or even you. So let's just please be careful, because we can slow this down.
All right, Hunter, you can go ahead.
Thank you, Renee. Thank you, Governor. I have two questions. The first one for you, Governor. The second one for Commissioner Tyndall. The first question for you, Governor, is I do understand, as I was at the game on Thursday along with yourself, there was a limited capacity based on what you guys had spoken about with the executive order. The question I have for you is how you felt about the social distancing. Even though there wasn't quite enough people there, they all seemed pretty close, and there was a very limited supply of masks. Secondly, Commissioner Tyndall, the question for you would be about the sort of reason that there's been so much activity happening online. Is that because of the number of employees that in the department, in the public safety department, or is that just because that's a try to transition to technology right now? Thank you.
Thank you, Hunter. I appreciate the question, and what I would tell you with respect to the crowd size, and I'm not going to comment with any specificity on any one game, because I have been witnessing and getting pictures from a large number of games, and what I would say is that by and large, most people are doing the right thing by maintaining social distancing, no more than or at least 6 feet apart from those who are not in their own family structure. Most people to and from the stands are wearing a mask most of the time, and certainly if everyone will continue to adhere to those measures and stay away from large gatherings where super spreading occurs, then I think we can continue to maintain our downward trend. If, however, the people decide that they no longer want to participate and to work hard, and then we'll start seeing the numbers go back up. But I believe that so many of my fellow Mississippians over the last 6 weeks to 2 months have really made a tremendous effort, and it's made a difference. I mean, you can look at the numbers, and there is no way to look at our numbers right now and say anything other than what you are doing is making a difference. When you talk, I mean, clearly we came out of the last 3 days, which admittedly were a holiday weekend, but we had less than 900 total cases over 3 days. That's a huge improvement. Now, I expect that as we go into tomorrow and Thursday, there'll be some larger numbers. I have no doubt that will be the case. We'll see, but certainly larger than what we've seen the last 3 days. But I can remember the day that we had 1,800 cases in one day. I can remember the week when we were sitting up here talking and we reached 1,381 cases on average over a 7-day period, where we had over 9,000 cases over 7 days. And again, we've had less than 900 over the last 3 days. And so, again, the numbers are headed in the right direction, but that is not a reason for us to say, ooh, all is good. We have accomplished our goal. No, we've got to keep being diligent so that we can keep doing the things that we want to do, albeit with less crowds than we are accustomed to. Sean.
Thank you, Governor. When it comes to the online renewals and your question, Hunter, I think it's a combination of things. Of course, technology and the improvement with technology, but really it's one of those things with COVID, it's really become more and more utilized. And it's looking at ways business operate differently, and sometimes, in some ways, we found better ways to operate our businesses, and that's what's happened at Driver's License Services, and that's what the customers have realized. Online renewals have been available. But with the closing down of the driver's license service stations for a 10-week period, and then the backlog that we had when we reopened, folks realized I can go online and renew my driver's license, and so they started using that service more than they had before. And then with the fact that you can renew your license for an 8-year time period, that means really you only have to go to a driver's license service station once every 16 years to get your license renewed. So COVID really pushed folks to using online services. And then some of what we're offering here, again, is advancements in technology and realizing how we can use that technology to save time for our customers. So the technology advancements have been key, and then the willingness with the department to make a change to take advantage of those increases in technology have been the other component.
I would just say that the improvements in technology and the offerings by the department, and again, I want to commend everyone there, and particularly Commissioner Tindall, but I also want to acknowledge the role that each of you play. More people know that they can go online and get their licenses renewed because you have done a good job of helping us spread the word. And so the fact is, America is changing, Mississippi is changing, the use of online technology. I mean, how many people did Zoom meetings a year ago? Very, very few. How many people do Zoom meetings today? Virtually everyone in corporate America and every small business owner are doing Zoom meetings today, and it's initially out of necessity because that was the only way to conduct business 6 months ago. Well, now a lot of us have figured out we can do a Zoom meeting, and rather than flying an hour and a half somewhere, having a meeting for an hour and a half, and then flying back, or driving and then driving back, we can get it done in an hour, and we can move on to the next thing. It's about moving towards innovative ways to do business, and state government should be the leader in that, and certainly Commissioner Tindall and his team and the efforts that they've put in are making it easier for Mississippians to go online and to do things, and that's, by the way, by definition, the more people who go online and get their license renewed, that is by definition fewer people at the bureaus throughout the state, which is good for COVID protection and also good for reducing the lines.
Thank you, Governor. Dr. Dobbs, you've talked about knowing what's coming in the next few weeks or a month, an expected spike. Some might call it a second wave. Would that make this the possible end of the first wave, because we've seen such a declining trend, almost the calm before the storm, if you will, before we hit this second one? And I've got a follow-up.
Yeah, it's all semantics as far as the waves go. Yeah, so maybe we've sort of had a little bit of a respite from our sort of gradually increasing and terrifying first wave. But it's hard to know what's going to happen in the future, and I've learned I'm a very poor predictor of mass psychology, is when we collectively decide to do the right things work out really great for us. The virus it sits at the tipping point. It either, if you do enough right, it kind of goes down, and if you just don't do enough right, it goes up exponentially. So I'm hopeful, I would be hopeful that if we can just really be thoughtful about it, we won't even have another wave. I'm more encouraged than I would be, although, we're going to, it's hard to imagine we're not going to have some headwinds ahead of us as far as like cold weather and, accumulation of school and college and then holidays and, people sort of letting their guard down. But we'll watch it closely, especially with flu season coming up. So, yeah, everybody get their flu shot. Go ahead. Now's the time between now and end of October is the prime time to get your shot. So go ahead and knock it out. But we'll just work diligently to try to keep it from being a second wave.
That's actually part of my follow-up. It's kind of a two-part of it. What do you think we've learned from this first wave that will help us later this year whenever we have that uptick, whether it's a major one or a minor one? And then also, too, dealing with flu season, how that makes things harder, when you're trying to anticipate this and adjust accordingly.
Yeah, so, I think we've learned that we can't let our guard down, right? If it's this virus is here, and this virus might be here for a while, actually. Depending on the efficacy of the vaccine, this might become almost like a flu sort of thing for the foreseeable future. So, gotta keep our guard up. I think part of it is early on everyone was petrified. You'd see people walking around like they were in moon suits almost. But now we feel pretty good that we can go to the grocery store with a mask on and feel pretty comfortable. So I think that we've learned that the modest stuff makes a big difference. And then going into the flu season, obviously the diagnostic challenge is going to be there for our clinicians, but there are going to be some sort of combo tests out there where you can do flu and COVID at the same time. I think we're going to do a lot more flu tests this year too, and I'm hoping to see an uptick in flu vaccines. But if we are diligent with our social distancing and masking, hopefully like they saw in Australia and South Africa, we'll see a milder than normal flu season.
I wanted to actually follow up on flu season as well. I've heard some people just concerned that there might not be enough flu vaccines as we go into this year. Is there a concern about a shortage, and when can people start to expect to receive their flu vaccine?
Now's time to get your flu vaccine, so go ahead and go. We definitely want it before the end of October. We don't have any anticipated shortages of flu vaccine. Sometimes we do. Sometimes if the virus is a little bit overly pathogenic to the eggs that they use to grow it in, sometimes it can be kind of a short batch. But this year we have every anticipation there'll be adequate flu shots. So go out there and get one. And now's the time.
Thank you, Governor. So as we've been, as we've been saying throughout this briefing, clearly big gatherings are wrong. Block parties can lead to outbreaks, and clearly it's in violation of the executive order. How is that different from the state fair? I know the state fair as of right now is still on. So what have your conversations been like with Commissioner Andy Gibson to make sure that can go on without any violations or putting people at risk?
Well, what I would tell you is that Commissioner Gibson and his team have been working very diligently to put together a plan. They've utilized the executive orders that we currently have in place, and what they've tried to do is lay out a map of the fairgrounds, which obviously is a very large outdoor space. There are some indoor venues, and they recognize that the indoor venues certainly have challenges that the outdoor venue don't necessarily have, and so they're going to make adjustments to their plans. They also, as I appreciate it, recognize that there are certain populations that are more vulnerable than others. For instance, the older population, this virus has been very challenging to those over the age of 60. You see that some, and I forget exact numbers, but between 80 and 85% of total fatalities have occurred in those over the age of 60. And so they are working diligently to lay out a mapping plan and make adjustments to what the normal fair would look like so as to allow a fair to go forward that meets the guidelines as they currently exist, assuming, of course, that the guidelines don't change in a negative way for them. And again, if the numbers continue to decline, it's not likely that we will change that significantly. And so, again, I don't know of any final decisions. They are definitely working very, very diligently to lay out a plan which would allow for it to go forward safely.
Ross?
Governor, earlier you said that people shouldn't attend parties, but in relation to cruising the coast, you're saying they should go ahead with that if they can social distancing. Clearly they're going to be more than 19 or 20 people, going to be thousands of people at cruising the coast. Should that event be canceled?
Well, that event, of course, doesn't occur at one street address in one community. That event actually occurs from the state line to the state line, so it's about 80 miles long, and so and it is literally an event that occurs throughout the entire Mississippi Gulf Coast. What they can't do is throw big parties in bars, for instance. They can't. They're not going to be able to have large social gatherings in indoor venues. And again, I'm not an expert on all of the specific things that they do for that particular event. I've been a lot, and some of the vast majority of the things that I've gone to have been outdoors and have been fairly small groups sitting on the side of the road watching cars go by as individuals sit in their cars. So again, we're gonna certainly monitor that, but if they can do it in such a way that it adheres to the executive orders, such that we ensure that the outdoor events have social distancing, that people are wearing masks, then it's like any other event that occurs out there, whether it's a high school football game where 25% capacity limitations are in place. If they can meet all of those guidelines, then that event, any other event, can take place. But it takes a lot of work and a lot of effort and a lot of planning to make sure that they have the people in place to ensure that occurs. I in fact, spoke, for instance, with someone who was doing an event recently, and they were talking about ways that they were going to work to ensure that there wasn't a lot of people coming together in close areas. So, for instance, if you're talking about the state fair, if you have someone checking to make sure that if there is a line to get on a ride, that every person, or at least every different family unit, is spread out at least 6 feet apart, and those individuals have on masks, then the likelihood of spread and transmission is relatively low. It's certainly not zero, by the way. There is risk to anything that you do. There's certainly risk, by the way, if you go to one of these events, but what we're talking about is trying to minimize and mitigate risk for the participants.
Dr. Dobbs, the president has said that he wants a vaccine before the end of the year. The CDC has said to prepare for COVID-19 vaccines by early November, as early as October. Based on your experience as an infectious disease specialist expert, how likely is that?
We've heard different estimates. Part of it is unknown because it's going to be dependent upon the results of the studies, and sometimes, that can be unpredictable, and that's just part of the nature of it. Most of our conversations with the CDC folks in preparations for a vaccine plan, we're looking really most likely at the first part of 2021 to have this. Might there be some small volume available before then, plausibly, but we anticipate in a more practical manner having some vaccine probably available to distribute first part of 2021.
And let me just say this, because it's been interesting to see the back and forth, and it's unfortunate that many things that have occurred in 2020, but it's certainly unfortunate that if we were going to have a pandemic, the likes of which we haven't seen in over 100 years, that it would happen to occur, maybe it wasn't happenstance, but that it would happen to occur during an election year, which has made a large number of people to look at every single decision from a political viewpoint, and that certainly hasn't always been helpful. But just to be clear, in my view, the president has taken unprecedented action by working with the Congress to get resources available such that should these various vaccines actually work and be approved, that much of the production has already begun. But make no mistake, the President of the United States or no politician is going to approve or say yes or no as to whether or not a vaccine can be distributed. That is going to be approved either by the individual companies who, and there are many of them, by the way, there are at least 3 or 4 different individual pharmaceutical companies that are working on a vaccine as we speak, and they are going to speak to whether or not the vaccine works, and it's ultimately going to be approved by the CDC before that becomes available. And so while I want to commend the president on taking this unprecedented action and make sure resources are available, public resources are available to help these private entities get going, at the end of the day, it is not the president that's going to say yes or no. It's going to be the scientists and those who actually provide for the studies.
Thank you, Dr. Dobbs. Just a question for you, sort of a follow-up to the vaccine. So what exactly is the testing process to make sure that we have a vaccine that is accurate and works? And in your experience, I know you're focused on solely Mississippi, but are any of these companies, that close to that yet, to where we could see it by the end of the year, or just what do we got to look for?
Yeah, and I won't bore you with the details because I've spent hours and hours, poring over the research, and it's really fascinating. It has been a really innovative strategy to try to basically do all steps and sort of simultaneously, the research, the building up the factories, making sure that you could sort of like roll it out at the same time. So it's really been remarkable to see. I don't think there's any shortcuts on the safety steps so far, which is fantastic. There's 3 stages. We typically talk about a phase 1, sort of like an introductory to kind of just see how it works, make sure it's safe. And phase 3, the big one, and a lot of these are in phase 3 trials with 30,000 people to really look and see, are there any unanticipated side effects and how effective it is. I think it's going to be a good process. There are several companies that have innovative products, and that's going to be part of it too. Some of them are relatively new. Some of them are just like the flu shot. It's just like a protein. It's just the same, and some have new technologies. So we've learned a lot. It's actually going to accelerate our capacity to make vaccines in the future also.
Can you hear me? All right.
We can.
What is your response? Okay. What is your response to a recent study which says Oxford is ranked as number 3 for the greatest number of new cases relative to their population in the last 2 weeks? What's the best way to curb this spread of COVID-19 on a big campus like Ole Miss? And do you think students are not being disciplined enough in terms of staying away from large gatherings? And I have a follow-up question.
Well, I would just say I haven't seen the study that you referred to, which says that. I have been looking at the total number of cases in Lafayette County, as well as the total number of cases in Oktibbeha County, and of course Forest County and Hinds County, and they have been driven to a certain extent over the last couple of weeks by what's going on the campus, and in many instances off the campus in terms of parties. But again, the numbers are the number of new cases in Lafayette County certainly are more with kids on campus, but they're not at an alarming rate at this point. We expected that as kids got on campus, as we did more testing of those kids, that we would see cases, and we've just got to follow hospitalizations and other data as well. But again, I hadn't seen the study, so it'd be hard for me to comment on it specifically.
All right, it's from the New York Times. But I have a follow-up question. There continues to be outbreaks inside the jails, including one in DeSoto County. You report that 11 inmates who are trustees tested positive for the virus. What do you think is the best way to slow down the spread inside the correctional facilities? Do you believe that, having these trustees be out and about in the community could contribute to the spread inside the jail? And Dr. Dobbs or Governor Reeves, you could answer this, whoever wants to.
Well, certainly, it's a congregate setting, so it's going to be high risk. The same rules apply under every circumstance. Indoors is going to be dicier, but it's kind of hard to be outdoors if you're in corrections, so that's not really much of an option. Masks and distancing are important, but also prompt isolation and quarantine are going to be things that kind of sort of limit the spread. We have been working with DeSoto County, and we do work with them to try to help mitigate the transmission risk. There's always going to be a risk when you have people coming in and out, especially employees, and you have people asymptomatic, and that just reinforces why these basic measures, the masks and the distancing, are so important, because you never know who's contagious. You got to pretend like anybody who walks through that door has coronavirus, because some of them are going to have it.
Well, it looks like we've made it to 3:30. Had an hour of good conversation today. Again, I want to thank all Mississippians for what you are doing. I want to reiterate what Dr. Dobbs just said. If you will assume that everyone you come in contact with has the coronavirus, and therefore you will wear a mask, you will stay more than 6 feet apart from them, and you will not get in very large gatherings, we have a real chance to continue to step on the numbers and continue to reduce them like we have seen over the last several weeks. But we have to continue to work and continue to try to avoid these large social gatherings, that some of which y'all have talked about today. So again, thank you all for being here. Stay safe out there, Mississippi. God bless.